All right, thanks for joining us this afternoon, folks. So I think like all Manitobans, my colleague Uzoma, our health critic, and I are encouraged to see the first doses of the vaccine arrive here in Manitoba. But we still know that there is going to be a very important period that we all have to make through together before this pandemic is under control. So while there is some encouragement on the horizon, today we want to address what is a very serious issue in the intensive care units and in the hospitals here in Manitoba. Now, the reason why this is so important to us as an issue is because the intensive care units are one of the places where the sickest people get treatment, and as a result, as we make our way through this pandemic together, they're one of the key touchstones that will allow us to have a strong provincial response. Now, what we're bringing forward today is the concern of many nurses and people working in the ICUs who are concerned with the provincial plan. Now, one of the things that's most top of mind in terms of the concerns brought forward is that this plan was designed by KPMG, which is a multinational consulting firm that most Manitobans might remember for bringing in the previous round of healthcare cuts that we saw here in the province of Manitoba. So their involvement is a bit of a concern because it suggests that the decisions are being made by money principles rather than by the principles which guide those people working at the bedside and the front lines of our healthcare system. Now, some of the other concerns that the nurses are going to be raising more and more in the future, and they raise in these emails that we have shared today, are that burnout is a major issue and that there is concerns about the level of care that patients will receive. And I'll invite Uzoma to touch on that just in a minute. But I just wanted to share the following. When we're talking about a consulting firm making these decisions that could potentially impact the lives of so many Manitobans. I was told by a doctor once that the further you get from the bedside, the worse the decision making gets. In this instance, it seems like the headquarters of a multinational consulting firm is probably about as far away from the bedside as you can get. On the flip side, when we're hearing from those frontline healthcare heroes, those nurses, those doctors working in the intensive care unit, and they're saying that they have serious concerns about the plan that's being brought forward, well, I think we need to listen to those. And so perhaps, while we all want the vaccine to be able to come and give us some deliverance from this terrible pandemic, we know that we should listen to these people on the front lines so that we can make it through this challenging period between now and then together. So with those opening comments out of the way, I'll invite